Dear friends from AHA and so many young people from China, good afternoon. First of all, I would like to congratulate AHA's great success and achievements in past 100 years. Secondly, I highly appreciate my good friends, Professor Xinliang Ma's initiation and recommendation of my topics today. Pioneering the frontiers of cardiovascular medicine in China. And he put it in such a unique session. Thank you so much.
Who is the one that started this Great War? We all know that. Yeah, thank you.
Thank you. As the founder of GWICC, in the next 50 minutes, I will share with all of you the story of GWICC in last 35 years. The Great War International Congress of Cardiology, GWICC, was founded by Italian cardiologist Germano Di Stasio. Filipino Chinese American surgeon Dr. Oyak and myself we together initiated the Great War International Training Course focused on EP and the coronary artery intervention in 1990. We renamed it as GWICC in year of 1993. GWICC continues to introduce and promote new ideas such as smoking cessation, exercise is good medicine, rehabilitation, prevention, and e-health services, which has led the development of related disciplines in China. This photo was taken in 41 years in the campus of med school of the United States of medical school in Chicago. The GWICC have made 3 opens. Number 1, we work very hard to open Chinese cardiovascular medicine to the world. Number 2, we open opportunities to the training, opportunity of training and the development of young generations. The thing in China If your student learn, you will lose your breastbone. I think I'm first of all one of the first cardiologists to open the opportunity to all young people. It's totally changed the situation in China in 1990s. I'm very proud of it. Number 3, we opened the multidisciplinary collaboration. WICC started the first live demo training in China. At that time, it's difficult to get the equipment. We had to borrow the equipment from CCTV, China Central TV station. GWICC built up the first bridge for China and international communications. In 1994, GWICC collaborated with the North American Society of Pacing and the EP, NASP, now called Heart Rhythm Society. In 1997, Professor Brownwald, known as the father of cardiology in the world, was invited to attend the Great Wall Congress. Professor Eugene Brownwald only visited China once. He had the keynote speech after opening ceremony. In 1999, Professor Spencer King, then president of the American College of Cardiology, was invited to give an academic report on advancements in interventional cardiology at the 10th Great Wall Congress. GWICC built up a relationship, friendship, and cooperation with many international, important, famous societies and associations. Today, I want to present my special thanks to AHA. After WICC in the United States, I started CCEP in China in April 17, year 2004. We try to increase public awareness and educate the public about the role of lipid disorders and its effects on health through outreach activities. We promoted healthy lifestyle and organized enhanced medical training for cardiologists and all other physicians, including GPs. I finished the first epidemiology and the risk factors for stroke in patients with atrial fibrillation in China. After European heart survey was published in European Journal of Cardiology, I designed and organized the China Heart Survey. We found out the proportion of patients with already diagnosed diabetes increased from 32.8% at baseline to 52.9% post-OGTT analysis. Pre-diabetes and diabetes was very, very common in patients who are already suffering from coronary heart disease. Our study result published also in European Heart Journal. As one of the PI, we cooperate with Diabetes Society in China and Oxford. We did the ACE trial, which demonstrates the effects of alcopols on cardiovascular and diabetes outcomes in patients with coronary heart disease and impaired glucose tolerance. This is a randomized, double-blind, placebo-controlled study. We found out, compared to placebo, alcopols did not reduce cardiovascular outcomes, but it did reduce risk of new diabetes. I have one of the best lab and team which keep doing lung QT syndrome and the Brugada syndrome. We may my ARG friends may remember the city. You had an annual meeting in year 1987. Can you remember what city? Big D, Dallas. Yes. This is the first time for me to attend big annual meeting in the United States. After I finished my 2-year training, I tried to find a cheap hotel. So I stayed in Coops, the hotel, Coops Urban Center. I have opportunity start knowing Kenneth Cooper. He's my good friend, a teacher. I think he is 93 years old this year. He taught me exercise is good medicine. Also, he told me all the hospitals, physicians, working hard to waiting cardiovascular events to occur. They don't do much before for prevention and afterwards for cardiac rehabilitation and the second prevention. So Cooper's clinic is very unique hospital. He only do two sides. They do prevention and rehabilitation, second prevention. I'm getting old, but I'm still very active. I started Chinese cardiopulmonary prevention and rehabilitation program in 2012. And restart the long march. We have invited Dr. Thomas from Mayo Clinic and friends from the Japanese Society of Cardiac Rehabilitation joined the Great Wall Congress. In 2012, in such a big country, there were so many patients with heart disease. However, only 6 rehabilitation centers in China. "12 years passed. Now we have more than 800 centers. The number still increase very rapidly. In summary, GWICC keeps leading the development and the international cooperation of cardiovascular medicine, promoting openness of the academic platforms, advancing international exchanges and communications in cardiovascular medicine, cultivating at least three generations of cardiovascular medical talents, and focusing conceptual and technological innovation. Thank you for your attention.